Today's training is over risk management and keeping our clients safe while doing home care. Safety is the freedom from danger and rash injury. Risk management is what we can do to reduce the chance of things happening to our clients and keeping them safe. We want to make sure that we keep our clients safe and ourselves, so we offer safety trainings to all of our caregivers and anyone who has direct contact with clients so that they know some basic tools and tips to keep themselves and their clients safe while doing healthcare. Well, a lot of times we think when we are looking at our clients that we're worried about them having heart attacks or having health related injuries. But really, one thing that we need to be careful of is just some of the household injuries that can happen. About 30% of older adults over 65 have a fall in their home with every year. So, and they usually result in some sort of injury. So, we want to make sure that we are looking for these things, just common tips, while we are doing our healthcare with them. If you're trying to prevent a fall in your client's home, you want to definitely look for clutter in their house. If they have items or furniture that is blocking walkways, you want to make sure that you are looking for that and then helping them clear it if necessary. If they have railings in their home and stairs, you want to make sure that those railings are sturdy, that they're not damaged. Lighting in the house is also something that you can be looking for. If there's poor lighting in hallways, that's definitely a high risk situation. If they have to get up in the middle of the night and they're trying to make it to the bathroom or something like that, we want to make sure that there's enough light for them to see where their feet are being placed and also how to get to other rooms in their house. If there's electric cords and things like that that are items in the walkways, those are trip hazards for kids and for older adults. So we want to make sure that those walkways are clear and that there's no cords that haven't been taped down or secured through major walkways that they go through most of the time. Also, when we're looking at how our clients are dressed, we want to make sure that their shoes fit properly, that they are snug around their feet but not tight. We want to make sure that their clothing as well fits appropriately and isn't loose or could become a tripping hazard because the pants are too long and things like that. When we're helping them get dressed, we want to make sure that if they need to be wearing a belt, those kind of things, that they are in place so that they are not tripping over their clothing or their shoes when they're moving around. Also, if they're in their home, if the floor is cluttered or if it's uneven, those can also be other signs of risk that might happen to them while they're moving around their home. Other reasons that clients may fall in the home have to do with medical reasons. If they are having poor eyesight or if their gait is unsteady, if they're unbalanced when they're walking around, you want to keep an eye out for those sorts of things. Also, ask your clients and be aware of how they feel after they take certain medications. Some medications will make them drowsy. So if you know that they're taking that medication in the morning or in the evening or something like that, you might suggest that they sit more instead of moving around after they taking that medication so they can be aware of their reactions. The other thing is they need to be making their regular health assessment appointments. Sometimes, especially when they go into the hospital, the ER might discharge them with meds that react to other meds that they were taking, and that can be really confusing for clients. So make sure that they are giving those new meds to their doctor so that he can make adjustments on any other meds that they're making, any other meds that they are taking, so that they aren't double dosing on two different meds or taking meds that might have a reaction to each other that might make them feel sick to their stomach or unsteady or dizzy or anything like that. And if you see them having a reaction to a medication that becomes unsafe, make sure that you're encouraging them or helping them call their physician and let them know that they're having a reaction to a certain medication. Other things that we can do when we are helping our clients is anytime you're going into a new client's home or even every a couple of times a year with your current clients, you might want to be looking just at their escape plans. If there was something to happen in their home, if there was a fire in their home or some sort of gas leak or something like that, you want to make sure that you're aware of where the exits are and that they are as well of how they can get out of their home in a hurry. A lot of times when we're in the middle of a fire, people panic and we lose, precious seconds. So we want to make sure that those walkways are clear to closest exit, and that they are aware of how to get out of their home, and that you are as well if those things happen. Make sure that you are kind of taking into account any sort of medical equipment that is in their home that would need to be exited with them, or that may cause them hazard if you leave it behind, such as those clients that are on oxygen, or if they are carrying equipment like as a walker or a cane or something like that. Those things will definitely be factors that you would need to consider if you needed to get out of their home quickly in the event of an emergency. Make sure if they have smoke detectors that you can help them check them, or encourage them to make sure that they're getting their smoke detectors checked at least twice a year, so that they are aware if there's fire going in their house, that those alarms are going off and not dead or without a battery or something like that. It's always your responsibility to report if there's any incidents or accidents in your client's home while you're on duty, or even if you're off duty. So if you get there and they make you aware that they fell the day before, that does impact care. So you want to make sure that you are reporting that to us. Even if it's after hours, we always answer on the phone. So leave a message for our answering service, or they will connect you to the person that's on call, and you can let them know if there's an incident that has happened in your client's home. Examples of these incidents can be a client that falls while you're present and on duty, if a client falls while you're not present, or if you're in another room but the client falls or falls out of their bed trying to transfer themselves. You want to make sure that you call and notify the office of what's going on. If there's a car accident while you're performing services, for example, if you are riding with your client to a doctor's appointment and then there's a car accident, you want to report that. That does count as an incident while on duty. If there's any sort of injury to yourself while you're on duty, even if you cut your hand or something like that, you want to make sure that it might be just as simple as just letting us know that you cut your hand, but it is your responsibility to go ahead and report and let us know that something has happened. So if you need to report, you want to go ahead and ensure that you and your client are safe. So if your client has fallen or something like that, get them to a safe position before you make any sort of phone calls to us. Then you want to, if emergency services needs to be called or something like that, you want to take care of those things first. Then after that, you want to go ahead and call the agency and just let us know that what has happened while you were on duty. So if the client fell, if the client was in a car accident or something like that, you want to go ahead and give us a call and give us those details. Make sure that you kind of have your the story of what details happened during the incident, so that you can go ahead and report them easily. You want to know where it happened, what time it happened, who all was present, including yourself. If the client was present with other family members, make sure you get their names as well, so that you can write all that down and then give them to whoever is taking the report over the phone. And the other thing we're going to know is if anyone was hurt. If you don't know they're hurt because they ended up being transported or something like that, or you ended up leaving the home and you're not sure if they hurt, we will follow up and find out. So if you say, I don't know if they were hurt because I left after that, we'll still follow up. But if you know that they were hurt, then make sure that you report that. And yes, they hit their head, or yes, I do think they cut their hand, then we can write those things down. And also, you just want to be prepared that there might be follow-up questions or concerns later that you would need to be available for as well. So again, if you have any questions about how to report or how to keep your clients safe in the home, or anything about incidents or safety or managing risk, make sure you give us a call at the office at 817-457-8324, and just let us know if you had any questions about this training, so that we can follow up with you and make sure that you are confident about how to keep your clients safe and managing those risks while you're there.